Hi, my name's Allie. I'm going to be your nurse today, and I'm going to be doing your physical head to toe assessment. And I'm going to check my physician order. I'm going to get my supplies, and I'm going to wash my hands and provide privacy. And now I'm going to identify. I'm going to identify you as the patient. So, can I get your name and date of birth, please?
Jane Doe, 12/10/1955. Thank you.
Great. So I'm going to start by inspecting the head and face. I'm going to be inspecting the size and shape and symmetry of your head. I'm going to be looking at your hair, texture, the color, and also the distribution, and also the symmetry of your face. I'm going to be palpating your head for masses, injuries, lesions, or pediculosis. I'm also going to be assessing cranial nerve 7, which is your facial nerve, which is your taste and your sensation on your face, and also your facial expression, your smile. Okay, and then next we're going to inspect your skin. I'm going to inspect the color of your skin, if you have any lesions, any masses, the thickness of your skin. I'm going to be looking at your fingernails to see your capillary refill, if it's 1 to 2 seconds. Also going to be palpating your skin turgor. I'm going to be looking at your skin turgor and tenderness and temperature with the back of my hand. Next, I'm going to be looking at your eyes. I'm going to inspect your eyes, your eyelids, eyelashes, the dryness, the perla. I'm going to be looking at your pupils, equal round, reaction to light, and accommodation. I'm going to be using the Snellen chart to check your cranial nerve 2 for vision acuity. I'm going to be checking cranial nerve 3, 4, and 6, which is ocular, motor, trochlear, and adducens for your ocular motor movements and the cardinal gaze. Next, I'm going to be looking at your ears. I'm going to be inspecting the auricle, the appearance, tenderness, and drainage. I'm going to be testing your hearing acuity, which is cranial nerve 8, and I'm going to be doing that using the whisper test. I'm going to cover up one ear and speak in the opposite ear, and you're going to repeat back to me the three letters that I said to test your hearing acuity. And I'm also going to be using the otoscope upside down to look into your tympanic membrane. Next, I'm going to be looking at your nose. I'm going to be looking at the symmetry, the color, any lesions in your septum deviation. I'm going to be testing your cranial nerve 1, which is smell, and also going to test the patency of your nostrils. I'm going to cover one nostril, and you're going to breathe out the other, and do it on the other side. Next, I'm going to be looking at your mouth. I'm going to inspect your lips, teeth, gums, the symmetry of your uvula. I'm going to be looking at any drainage, noting any dentures. I'm going to be checking for cranial nerve 5, which is mastication, so opening and closing the mouth. Next, I'm going to inspect your throat. I'm going to be looking at your mucosa. I'm going to be looking at lumps, masses, and your ability to swallow. Excuse me. I'm going to also palpate your thyroid from behind, and I'm also going to be checking for lumps and the tracheal deviation. Also going to be assessing your cranial nerves 9, 10, and 12, which is 9 is swallow, 10 is gag reflex, and 12 is stick your tongue out and move it to side to side. Next is the thorax and lungs. I'm going to inspect the size, shape, and symmetry of your thorax. Excuse me. I'm going to be looking for any scars and your respiratory expansions to see if they're even. I'm going to place my hands on your back and in the front of your thorax and seeing if my hands move up and down equally. I'm also going to be checking to check to see if the anterior posterior diameter is 2 to 1 with the transverse diameter. Next, I'm going to palpate using tactile fermentus, saying with both hands on your back. As you say 99, I'm going to go down with both hands with the palms, saying 99.
99, 99, 99, 99, 99.
Good. So that was 99, 99, 99, 99. As you go down, and we're feeling for the vibrations and the sounds. Next, I'm going to percuss so that we can hear the thorax. And I'm going to just percuss going down. I'm going to percuss going down on each side. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5. So 1, 1, 2, 2, 3, 3, 4, 4, 5, 5. So once we do the percuss, then we're going to auscultate the lungs, and I'm going to auscultate the lungs on using the diaphragm. So take a deep breath in, 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 breath in. I'm going to do that 5 times. So after I do the auscultation, I'm going to be assessing your abdomen. I'm going to inspect the size, and I'm going to position the patient so that the patient is only the abdomen is showing. And I'm going to inspect the shape and the skin, and also I'm going to start with auscultation, and I'm going to auscultate the 4 quadrants of the abdomen, starting with the lower right quadrant, upper right quadrant, upper left quadrant, lower left quadrant. Next, I'm going to percuss the 4 quadrants, and then I'm going to palpate the 4 quadrants in the same way that I did. I'm going to go lower right quadrant, upper right quadrant, left upper quadrant, left lower quadrant. And I'm also going to be assessing for any hernias that might be. So next I'm going to be doing your cardiovascular assessment. I'm going to be noting the S1 and S2 sounds. S1 is loudest at the base, and S2 is loudest at the apex. S3 is going to be, if I lay you on the left side, it's only going to be heard on the left side. And 4 is a sound, 3 and 4 are sounds that you're not supposed to hear, but 4 is a sound that would happen right before S1 would occur. So I'm also going to be checking for any murmurs that you have with the bell of the stethoscope. I'm going to be pressing lightly with the bell of the stethoscope on each side of your carotid artery and checking for that. And then I'm gonna auscultate. I'm gonna check your JVD distension also in both sides of your neck. So if you could turn your neck to the side. Okay, thank you. And also, I'm gonna have you. Next I'm gonna auscultate your all the heart points, starting with the aortic, pulmonaric, Erb's point, tricuspid, and mitral. And then I'm going to assess your cranial nerve 9, which is shoulder shrug. Perfect. Okay, so now I'm going to assess your lymph nodes. I'm going to start with preauricular, postauricular, occipital, submental, submandibular, jugular, mandibular, superficial, deep cervical chain posterior, and supraclavicular. And next we're going to assess all your peripheral system. We're going to check all the pulses. So starting with your so your radial, ulnar, brachial, femoral, popliteal behind the knee, dorsal petis on the top of the foot, and posterior tibialis behind the leg, behind the calf. So next I'm also going to be looking at the skin color of your peripheral and the capillary refill on your toes, and also looking for any edemas, masses. Next I'm going to be doing your muscular assessment. I'm going to be testing your range of motions. So we're going to go through all the range of motions. So if you could just start with flexion and extension. Okay, flexion, extension, abduction, adduction, circumduction, all the way around.
I have arthritis.
Pronation, supination. Okay, you don't have to keep doing it. Pronation, supination. The foot is eversion or inversion, eversion. Retraction, protraction with the jaw. Retraction and protraction with the jaw. And then circular with the head. And which one am I missing? Wait, and then circular with the head, and I think that's it. So anyway, next we're gonna do the Fallon's test. We're gonna be assessing your nails to see if you have any clubbing. Go lay down, Morgan. Next we're gonna be doing your mental status. We're gonna be doing your mini mental status well, first we're going to check your awareness, alertness, and your orientation. Then we're going to be doing, I'm going to ask you what your name is, what your date of birth is, your location, and I'm gonna give you a four-word recall.
4?
I'm gonna give you a
Mm-hmm.
I'm gonna give you a 3-word recall, and I'm gonna tell those to you in the beginning of the assessment, and then you're gonna tell me them back at the end. So, lemon, blue, dog. Okay, and then we're also going to do the mini mental assessment, which is a 30-point scale assessment for assessing for any dementia or delirium, and the average score on that normally is like a 27. And then also you're going to be checking your recent and remote memory. Your recent memory being what time your appointment was today, and your remote memory being when is Christmas, for example. Now you're going to repeat those 3 words back to me before we move on to the next part.
Lemon, dog, blue.
Good. Okay,
Is that
so
right?
lastly, we're going to do the neuro test. I'm going to be testing for your pain using something a little sharp and a little dull. Then I'm going to be doing the Romberg test, which is a balance test. You're going to stand with your feet together. You're going to have your arms at the side, and you're going to close your eyes, and you're going to balance for about 20 seconds, and I'm going to watch your movement. Next, I'm going to be doing stereogenosis, and you're gonna close your eyes, and I'm gonna place an object in your hand, and you're gonna tell me what that familiar object is with your eyes closed. Next is graphesthesia, and you're gonna close your eyes again, and I'm gonna draw on your hand or on your back a familiar letter or number, and you're gonna tell me what you felt drawn on you.
7.
Perfect. And also we're going to be testing if you can feel vibrations, and then the Babinski test, which is testing a reflex on the bottom of your foot to check to see if you have any head trauma. So that concludes our head-to-toe assessment. Now I'm going to document everything, and you're free to go.
Thank you very much.